Radiology Associates, a new vision in imaging.
Hello, I'm Dr. John Carroll. Welcome to Radiology Associates.
We're going to explore different imaging options, including the most advanced cutting-edge techniques available today. Radiology Associates has been providing imaging services in our community for over 50 years. Tremendous change has and continues to occur in radiology. We strive to obtain the clearest images for you and your doctors to aid in your treatment and generalized health. Imaging has become central to diagnosing most ailments and pivotal in directing care.
When I went to medical school, I was uncertain which specialty I would ultimately pursue. But I do remember going on hospital rounds and discussing different diagnoses that could be affecting the patients. And after these long discussions, we always went to radiology to actually get the answer. Radiologists are the medical detectives. Why do I have headaches? What's causing my cough? Why does my belly hurt? What's wrong with my knee? These are all questions that we can answer as radiologists. Radiologists are physicians. We've completed medical school and a dedicated diagnostic radiology residency program. Many of us have additional fellowship training. There are multiple subspecialties within radiology. These include neuroradiology, musculoskeletal imaging, chest, cardiac, breast, and body imaging, interventional radiology, and nuclear medicine. At Radiology Associates, we have physicians representing all these areas. Imaging services are being offered at more locations, but many of these locations do not have a radiologist on site. In fact, your images are likely sent someplace else in the country or even the world. You don't know who your radiologist is. Here at Radiology Associates, we have a physician on site overseeing all facets of your care. You and your physician know who your radiologist is. At Radiology Associates, you can be confident we're providing state-of-the-art imaging and personalized care.
We believe the women in our community deserve specialized care. That is why we decided to create a separate women's waiting area where you can rest and relax in comfort while you await your exam. We have also introduced digital mammography into our centers. This brings more state-of-the-art imaging into our communities. The images are crisper and the reports are completed faster. We know there is nothing like the anxiety of waiting for the results on your mammogram. Now your doctors will have those results in hours, not days. Our staff are all experienced and board certified, and you will have the option of consulting with one of our highly trained radiologists for every diagnostic mammogram.
Breast cancer has become more curable over the last few decades. Much of this improvement is secondary to widespread screening and early detection with mammography. Digital mammography holds the promise of better sensitivity in finding breast cancers. We have introduced digital mammography to the counties we serve. Digital mammography is such an advancement that we no longer offer the older film screen mammography. Breast imaging goes beyond mammography. Ultrasound and MRI can be useful in evaluating breast lesions. The ultrasound examinations are performed at the same time as diagnostic evaluations. Some breast issues need further defining, and breast MR can help in those circumstances. Some lesions will ultimately need to be biopsied, and we can perform those procedures at our outpatient centers. Other women's services include bone density scans and pelvic ultrasound evaluations. As with breast cancer, early detection of any cancer can significantly improve one's chances of a good prognosis. Better characterization of masses will help your doctor tailor specific treatment. PET-CT has been used to accurately stage many tumors, including breast, colon, and lung cancers. At Radiology Associates, we only rely on the most sophisticated time-of-flight PET-CT scanners. We were the first outpatient center to install and use this new technology. Atherosclerosis, or hardening of the arteries, is a very common systemic disease. It can affect the whole body. Strokes, heart attacks, and PAD, or peripheral arterial disease, are all manifestations of atherosclerosis. Accurately imaging the arteries can dramatically aid in treating any significant blockage from plaque. Symptoms of atherosclerosis include confusion and TIAs, chest pain and tightness, and pain or heaviness in the legs with walking.
The revolution of radiology participation in vascular disease is not just limited to diagnosis. In fact, we have been the pioneers of minimally invasive vascular treatment for over 40 years. The interventional radiologist is essentially a subspecialty trained radiologist. We go through the same medical school training, residency training, so on and so forth as our diagnostic colleagues, and we are equipped to read CTs and ultrasounds and MRIs, so on and so forth, but we use these same technologies to do minimally invasive procedures. The evolution of endovascular treatment for vascular disease has required the radiologist to assume a more clinical role in the care of their patients as well. And we at Radiology Associates have responded with our subsidiary clinic, Florida Endovascular Specialists. We show them their disease process using the CT or MR or imaging technique that was acquired, and how we're going to make them better and get them started onto a new way of life to prevent recurrence. One of the most exciting new developments in the endovascular treatment of peripheral vascular disease is the atherectomy device.
You know, especially when I would go shopping, or if I had to do a lot of walking with a client on a big property, I would feel those pains and really didn't think much of it.
Not being able to do the things that I had been doing for the last 40 years. I love to play golf. You know, when my kids were young, we went to the athletic club and played racquetball. It bothered me quite a bit. And not knowing what it was, or what the problem was, bothered me even more.
At Radiology Associates, we have the ability to define the arterial system, including the aorta, the carotids, the coronaries, the renals, and the peripheral arteries.
When I was in residency, I always thought I would stay in academic medicine because of the subspecialty I chose in cardiothoracic imaging. It requires state-of-the-art equipment, and I have found that at Radiology Associates. CTA of the coronaries evaluates the arteries of the heart non-invasively, without cardiac catheterization, and can characterize the atherosclerotic plaque in the vessels and determine if there is blockage and need for further treatment options. Cardiac MRI is a great intervention because it can evaluate the function of the heart and can look at the valves and see if they function properly. It is also used as a stress test to evaluate for ischemia, and another fascinating thing about MRI is that it actually shows heart attacks that are not seen by any other study.
We reconstruct the images in any plane in such detail that conventional arteriograms are rarely needed. Florida Endovascular Specialists consult patients about their treatment options.
Talked to him a little bit while it was going on, but I had no pain from the procedure.
I could see it actually cleaning out the artery itself and opening up. I could see the blockage before, and I could see the clearing afterwards. To me, that was amazing.
I just got better quick. I mean, it was amazing. My family says that it's almost like after the procedure, I just jumped off the bed and started running.
I was out of the procedure room at 6 o'clock that evening, and I was on my feet at 10 o'clock. And I left the next morning, and I went with my wife and son and a friend of his and played golf.
Varicose veins can be painful and unsightly. They are caused when vein valves no longer function. This prevents the flow of blood back to the heart and causes the veins to distend. There are fairly easy methods to alleviate the varicose veins. These options can be discussed at Florida Endovascular Specialist.
Since I had the treatment, there's nothing that I can't wear anymore. That's probably the best thing. And if you can run outside and you know that people aren't standing behind you going, oh my God, her legs look so bad, I just feel so much better about it.
Fibroid tumors of the uterus affect many women. They cause heavy bleeding and pelvic pain. Typically, they are treated with a hysterectomy, but now there is a simpler alternative. Fibroid embolization is a procedure performed through a catheter to disrupt the blood supply to the tumors. At Florida Endovascular Specialist, treatment options of embolization of uterine fibroid tumors can be discussed when appropriate.
I was shocked that I hadn't learned about this before, that I had to learn about this purely by accident. I went in, I went to sleep, I woke up, and I had 2 Band-Aids. That was it.
Headache, back pain, weakness, and confusion are common ailments that need further evaluation. Examinations of the brain and spine require very precise delineation of the fine structures. Radiology Associates is the leader in providing high-resolution imaging. We have the only 3T MRI scanners in East Central Florida. We also have open high field and open upright MR scanners. We have several state-of-the-art 64-slice CT scanners. More accurate imaging leads to better and more confident results. Our advanced technology does allow very detailed reconstructions to be created in any view. Radiology Associates uses advanced time-of-flight PET-CT scanners to detect Alzheimer's at the earliest stage to help combat this ailment. Recent treatment options have become available that offer an improved prognosis. The X-ray is one of the most basic examinations performed in our centers. Conventional X-rays have been around for decades. All images at Radiology Associates, including X-rays, are obtained digitally. This allows the images to be modified to increase contrast or magnify areas of interest without loss of resolution. More advanced techniques to further evaluate the chest, abdomen, and pelvis include CT, MR, ultrasound, and nuclear scans. These examinations define either the anatomy or function of your organs. Radiology Associates works closely with your doctor to best tailor the examination for your condition. Everyone has aches and pains. When these limit your activities, or you have to change your lifestyle, something needs to be done.
My name is Justin White. I'm Director of Sports Medicine at Embry-Riddle University. Responsible for 14 collegiate teams and about approximately 250 athletes. Main responsibility of what we do is the prevention and care of athletic injuries. And one of the main things that we do with Radiology Associates, and what it allows us to do, is when an injury occurs, we can have our athletes in a scan as soon as possible, within 24 to 48 hours. That in turn allows us to figure out what the injury is, set goals, rehabilitation goals, and get that athlete back into class and back into to play as soon as possible.
I've had 3 ACL surgeries and 1 meniscus repair also. It's been hard trying to get back into playing soccer and being as comfortable as I used to be. Without the team of the Radiology Center and the sports medicine team, there's no way I'd still be playing soccer right now.
The 3T magnet has been a huge addition to us. So that's what our doctors recommend, that's what they want. It gives us the most clarity of those sites where the injury occurs, and allows our doctors to make the right call on whether or not that injury needs a possible surgery or if it's something that we can rehab.
It's been great having this system in place, and it's so close to my home, and having that access in such a small city has been awesome.
X-rays of the affected joints can demonstrate acute and chronic changes involving the bones. Bone scans are used to evaluate all the bones in the body for metabolic or systemic diseases that can affect the skeletal system. The soft tissues of a joint include the cartilage, ligaments, bursa, and tendons. MR is the best way to evaluate these structures in any joint in the body, from the TMJs, shoulders, elbows, wrist, hands, hips, knees, ankles, and feet. High-resolution imaging is necessary in directing treatment and ensuring recovery. This overview has shown some of the services we provide. We have emphasized our state-of-the-art equipment and displayed some of the wondrous images produced. Our personnel are equally important. The staff at Radiology Associates knows how important your imaging is to you. They are committed to being both professional and understanding. The physicians interpreting your images are all board-certified radiologists. We live here and are part of this community. We have affiliations with local institutions. We are available for consultation with your physician to ensure your individual healthcare needs are addressed. All of your digital images and reports are available for immediate review by your physician on our secure website. We thank you for allowing us to serve you.